Welcome to the Dr. Ed Show. I'm Dr. Edmund Sulkowski. We have a wonderful guest today, my good friend, Mr. Tom Yakopin. Tom, welcome.
Thanks for having me.
It's always my pleasure to have a conversation with you because we talk about so many things. Tom is an interesting guy. He's into music, and I love music, although I can't play like he does. He can bang some drums out here. But Tom is in the insurance business, healthcare, the financial aspects of it. And he's been actually a big influence in my life with my own personal health care. That's how I met Tom years ago when I was paying for high health insurance and really never using it. And it was almost a mortgage payment. In fact, I think it was a mortgage payment. And Tom sat down with me and really looked into what I needed and what I was using and what I did. And we cut that to a third of what it was.
I remember.
And
we sure did.
You founded something called Penn LIfe Health. So tell us about Penn LIfe Health.
Sure. You know, on one hand, Penn LIfe Health is just, like any other insurance agency right out there. I was living in Chicago at the time, prior to moving home. By the way, I was born and raised here, graduated from Canon Mac in '79. And traveled really all over the United States in the insurance business. Lived in New England, Baltimore, Cincinnati, Chicago. And then when my father fell ill, I moved back to Pittsburgh in '08. And I had a couple of other agencies that we started under different brands. But when I moved home, I thought it would be cool to brand something that was very, Pittsburgh, Pennsylvania. And my grandfather used to work for West Penn Power, and I thought, wonder if there's any challenge with naming the agency West Penn Life and Health. Our logo, as you know, is kind of the Pennsylvania Keystone.
Green and gold, or
yeah,
green and yellow.
Green and orange. Yeah, it kind of has a nice earthy vibe, and everything came together. I'm like, I like it, So, the name is very Pennsylvanian. It is. Reminds me of really the good steps that I've made coming home. We've really done well since 2008 to today, serving the community with life insurance, health insurance, Medicare, and safe money annuities, and that's what we specialize in, those four aspects of the health and financial services business.
So one of the things that always impressed me with you regarding this health insurance is we always hear this term, and I do want to say thank you to Tom. Tom's been the sponsor of my radio show, the Dr. Ed Show, from its conception, and part of the reason why I'm on the air there, and we're sharing a lot of good information. So
thank you.
So I've appreciated Tom in more ways than one, but we were always on the same page because you differentiated between the term health care and health insurance, and I think most people don't do that.
Yeah, absolutely. I mean, what we do is, I have contracts with insurance companies, and we provide risk management solutions. When I took my insurance exam in Springfield, Massachusetts in 1985, I can remember vividly some of the terms and definitions because that's a lot of what that particular test is, right? And one of the terms or definitions of insurance is a risk management tool to protect against unforeseen catastrophic loss. And if you think about health insurance back in the day, I mentioned my grandfather, Thomas P. Pierce, a World War I veteran, old school. My father was old school. World War II veteran, Frank F. Yakopin, great men. But both of them, when they would refer to benefits on their job, I recall the term hospitalization being used.
That's what
you remember
it used
that?
to be called, yeah.
Yeah, back in the day, that's what they called it. Hey, I got a great job. My father worked for the United States Bureau of Mines. I can imagine him coming home saying, honey, I've got a great job. And oh, by the way, it has hospitalization benefits too, And that's where health insurance started. It was to protect people against the unforeseen costs of, a major hospital bill. And then it kind of, evolved, as a lot of things do, into then I think the next phase that I recall, they referred to it often as major medical.
Major
Perhaps
medical.
you remember that,
Yes.
right? And you know, and again, if you just look at the words and you think about it, it was designed to protect against major medical expenses. Health insurance back in the day, prior to the Affordable Care Act passage, which that law was written in 2010 and it was enacted in 2014. Some people referred to it as Obamacare. The technical term is the Affordable Care Act legislation. But health insurance changed radically, where it seemed to me that every lobbyist and everybody that had money to send a lobbyist to Washington began to demand that this is included and that's included. And today you have these health plans, and if you notice, you know, the name changes, right? You know, this tragic murder in New York City with the United Healthcare CEO, you know, they talk about healthcare plans, how his healthcare plans did this or denied that or whatever. Health insurance is not healthcare. Health insurance was never designed to be healthcare. Healthcare is what your doctor renders in an office. Actually, as you and I often say, healthcare is eating the apple instead of the Snickers bar.
Yeah, exactly. It's what you do and what you contribute,
Yeah.
and your lifestyle and the insults and the things that you eliminate from your
Absolutely.
lifestyle.
And, you know, I use Dr. Rebecca Plute as my direct primary care physician, who I know has been on your show many times, and she and I have had many meaningful discussions about this fact, and we both share a similar philosophy, and that is, actually, it's sad that insurance companies today have positioned themselves as middlemen, often diluting the value of a patient-provider relationship. I hate to say it because, you know, I've done very well in the insurance business, but what it is today, what health insurance is today, with its costs, the idea that it is to cover every aspect of everybody's everything, it's just foolish. And the proof is in the pudding, because without federal subsidies, Ed, nobody would buy an ACA plan, because the average person wouldn't be able to afford it. It doesn't make sense financially. So that alone it causes me to, you know, question what we're doing, and what this monstrosity has become. Health insurance, you know, the idea that people fear getting good care without health insurance. You don't need health insurance to get good care. You know, I pay a small monthly fee to my direct primary care physician, who doesn't even take insurance. She doesn't want insurance because it has corrupted, in her opinion, her practice.
Insurance companies tend to dictate procedures,
They do.
and they shouldn't be able to do that, but that's what happens.
It is what happens. And going back to you and I, you know, one of the things that I became educated about, I was fortunate to meet a very wise man, kind of a disruptor, Dr. Keith Smith, anesthesiologist and one of the founding members of the Oklahoma Surgery Center. He's also one of the founding members of the Free Market Medical Association, who have a voice to kind of speak out about the fraud, the waste, the abuse, the corruption, you know, the involvement between big government and big insurance, you know, calling it out, because truthfully, it's kind of an unholy alliance, and the end result is that these large companies are now dictating care. You know, no slam, you know, again, I love Pittsburgh, and I know UPMC does some great things, but a classic example might be that UPMC, the insurance company, right, and it's an insurance entity, also owns hospitals under the same brand, and they have networks of doctors that ultimately are controlled by the checkbook. And who's the checkbook? It's the insurance company. And it never used to be this way. It used to be that your doctor was free to make the decisions based on their expertise. The patient could see any doctor, any hospital, anywhere, and if you felt it necessary, you would buy an insurance product from a financial institution to protect you against a large bill. But that insurance company, even in the mid-'80s, going into the very early '90s, those insurance companies were not involved with the networks and the coercion and the manipulation and the control that they seem to exercise today over physicians. So I definitely do things differently in my agency when I can, and we cannot always do that. But one of the things that we recommended to you was build a risk management system that works for you. If you're willing to take the responsibility of eating right, exercising, having a good relationship with a primary care physician, you don't need all these expensive tools. Because again, just like, I drove here in a nice car, I have a spare tire in the trunk. That's my insurance. I don't want to use the frickin' spare tire.
You're lucky these days to have a spare tire
exactly.
in your car.
And that's how I look at insurance. I have it, but I really don't want to use it. I have insurance on my log house. I don't want to burn a wing of it down to see how good the insurance works. And some people think exactly the opposite. Like, okay, I've got this great healthcare plan. Let's use the heck out of it. It's like, it's foolishness, especially at the premium and the costs of some of these plans. So if you're under 65, your listening audience should know that there are many quality alternatives to traditional major medical offered under the Affordable Care Act, including in some cases Christian sharing ministries, indemnity plans, hooking patients up with direct primary care physicians who might not even need or want insurance. So that's some of the things that we do differently, Ed, is think outside the box.
Yeah, you have a box that has a bunch of options in it.
Why not?
And you're not just selling one product.
Mm-hmm. Right.
And like when I first walked into your office, I thought, I'll be here 15 minutes and I'll be on my merry way. And I sat there with you for an hour and a half because you looked into every detail so that you could put the proper program together for me. Mm-hmm. And I don't think, first of all, you find that in a lot of agencies, but you and your support staff, I mean, you have Charnice, Janice, Jamie, and everybody's on the same page.
Yep, they get it. Yeah, they get it. I mean, Janice has been with me now, I think 8 years, Jamie 7 years, Charnice 6 years, and they're all very, very good at what they do.
Yeah, so
they pay attention.
Yeah, so like anybody that walks in there is going to have this undivided attention, and right now we have this open enrollment. I think by the time this show airs, that will have closed.
Yeah.
So let's
for
talk
Medicare.
For Medicare. So let's talk about what open enrollment is, just so that people have an understanding of it.
So every year with the Medicare Advantage plans, and Medicare Advantage, Medicare has 4 parts: Medicare A, B, that's original Medicare. Medicare C, that's the Medicare Advantage plans. Medicare D, that's the drug plan. But from October 15th to December 7th each year, for individuals wanting to enroll in a Medicare Advantage plan or in a Medicare Advantage plan that might feel the need to change, they can do that during this open enrollment period.
But no questions asked.
No questions asked, no medical underwriting. They could be hooked up to an iron lung, and we can move them from one plan to another. In January 1, it'll take over all of their care. So that's a very busy time for us. And again, the Medicare Advantage plans, they serve a great purpose. They kind of fit that model that we were talking about earlier, these all-encompassing whatevers, but it is what it is. And
well, I had a patient in the office last week, and she's was asking our front desk person, Jody, about what's a good dental plan. Well, Jody's not an insurance agent, but she's aware because she works with all the different insurance companies. And I was about ready to say to the patient, because I was in the outer office, you got to go up to West Penn LIfe, and the patient looked at me and said, well, I'm seeing Janice. You know Janice.
Yes.
in West Penn. I went, absolutely. You know what I mean? And so I knew she was in good hands. So I said, don't talk to Jody.
Yeah, go see.
Go see Janice.
Yeah.
But it's important because information arms you and protects you, and you want to make the right decisions because there's so much variations in these Medicare plans that you might pick something that's not right for you.
I agree.
And you know, I know you like Advantage plans, but if you're somebody that spends half the year, and I learned this from you, if you're someone that spends half the year in Florida, that might not be the plan for you.
Absolutely. Yeah, and I have no preference. I mean, I like Advantage plans because they are part of the landscape in our community. And in Western PA, they're very, very popular for a lot of reasons. But, you know, the mistakes that I see people make, and I get how this happens, is, you know, Aunt Mabel goes down to the beauty shop and she hears that her good friend has, you know, UPMC for life or Aetna or whatever. And she's like, well, you know, my good friend has this plan and she loves it. So she might come in the office and say, that's what I want. Well, obviously, ma'am, you have a reason for feeling that way. Do you mind if I ask you what it is? Well, my good friend has it, okay? Well, that's a very foolish way to make a decision because your friend's drug formulary, what she's taking for prescriptions, might be radically different than what you're taking. Most Medicare Advantage plans are managed care plans, meaning you have to use certain doctors and hospitals. Are you seeing her doctors? You know, so we actually start from the ground up. When people come to us, I've trained my staff, myself, is I ask a lot of questions. Seek first to understand before seeking to be understood is our motto. So, you know, you want this, why do you want it? Have you evaluated their formulary? Are all your prescription drugs going to be covered? Do you know that? Well, I don't know. We should look at that, right? Because that could cost you a lot of money. Are the doctors that you're now seeing or the doctors that you want to see, are they in that plan's network? Well, I don't know. Well, we should know that. Because a plan may, you know, the booklet may read great and Aunt Millie may love it, but if your doctors aren't in the network, you're not going to love it. And if your
you're
drugs
paying out of pocket,
right? Yeah, exactly. So we start with the essentials. Who are you seeing? What do you take? How do you access healthcare? And as you said, original Medicare radically differs from Medicare Advantage plans. And for certain individuals, a Medicare Advantage plan would be a bad choice. And so that's really where we start with everybody. How do you access care? What is your lifestyle? Do you live here year-round? Do you have a home in Florida, Arizona? Where are you going to be seeking care? Things of that nature. And all of these aspects, I think, determine, you know, my recommendation to people.
So you turn 65, so you have how length of time to sign up for Medicare?
Sure. When you're aging into Medicare, you are encouraged 3 months prior to your 65th birthday, and then you have 3 months following your 65th birthday. So you have this 6-month window, let's call it, where you have a special election or your initial election period. So you've got 6 months to figure out which way the parade's going, you know?
And you're not going to figure that out by an advertisement on TV.
No, you're not. No, that's, you're not.
Some 800 number.
Yeah. Yeah, I get it. I advertise, I get advertisements, you know, you want the phone to ring. But I think people should make informed decisions. You know, a decision is only as good as the facts.
Right.
So you want to get the facts. And the facts aren't, you know, I like this brand or I like that logo or, you know, again, Cousin Bill has the plan, so clearly it's going to work for me because Cousin Bill's a great guy. No, let's sit down. Allow us to chat with you, ask you meaningful questions about your health, your care, seeking care, prescriptions, doctors, etc., and build the plan that way. Let's determine what's best for you based on better information.
Because if you mentioned the term risk management, and
Yes.
and that's what you're doing.
That's what this is. Insurance is risk management. Insurance, you know, just like car insurance, right? It's protecting your assets. It's protecting you against lawsuits and damages and things of that nature. And you get to determine based on the deductible or comprehensive versus non-comprehensive, how much risk do you want to take? I mean, some people, I have friends that are, they're very wealthy people. Some of them might self-insure. Okay, if they own their own business, they may build their own healthcare plan their own way. And there's ways of doing that, to be frank with you, because they can handle more risk than somebody that might not have $3 million in a sinking fund, right? So, yeah, risk management is what insurance is. It's the purest definition of it, and that's really how I approach the business.
So, you do a Medicare plan during the open enrollment period, and then you go for a period of time, and suddenly something changes. Are you stuck in that plan?
No, you're not stuck. If you're in a Medicare Advantage plan, obviously AEP is one time you can change each year. If you're in a Medicare Advantage plan and you simply don't like it anymore and you want to go back to original Medicare A and B, you can do that. You can pick up a drug card should you need one if you go back to original Medicare. So you're never stuck, and that's a fact. I think one of the beauties to our system is that there's almost always a way to accomplish what you want to accomplish. But once again, if you don't have the facts, if you don't have good information, it's like one mentor of mine said, Tom, know your rights, right? Because they who don't know their rights have no rights at all. A lot of wisdom to that. Same thing with information. You don't know what you don't know, so you need good information, and you're not going to get that from a commercial on TV with Joe Namath telling you to call the Humana guy. Right?
Yeah.
Joe could throw a great football. I don't think he's a licensed broker, but
yeah, no. Education and information is paramount. It's just no question about it. And you want to be on the offense with it and not in the defense of it.
Yes, sir.
So that's why it's incredibly important to sit down with someone with the knowledge.
It is.
And the experience.
Yeah. And trust, right?
Yeah,
that's
absolutely.
the other thing. We have to earn people's trust, and if somebody doesn't know me or Janice, I call Janice Jackie, Shanice Jamie, I don't blame them for not trusting us, but at the end of the day, you have to trust somebody, okay, unless you're going to do all this research and whatever on your own. So it begins with trusting somebody, and I'm not saying I'm the only guy in town that can help people. But one of the things that I begin my conversation with the average Joe is, look, I want to get to know you. I want to find out what your needs are, what your problem is. Usually people pick up the phone and call us because they have a problem. Yeah. Okay, I want to know what the problem is, right? Because I really consider myself a problem solver.
Yeah, that's how I see myself all the time,
Yep.
too. You're always solving a problem.
That's it.
And it's, again, trust, absolutely important. But you need somebody that knows how to do that.
Bingo. Yeah.
And you start looking, like you said, unless you have the information, you're investigating yourself, you start going down a rabbit hole. And if you're not educated in the terms and the consequences, you get yourself into trouble.
Yeah, you do.
So it's like, I'm somewhat involved in the insurance business because I deal with it all the time.
Right.
But my comment is I know nothing about it. And I go to experts like you.
Yes.
And I know no one's an expert. I don't consider anybody, because we're always learning.
Always learning, bud.
But there are some of us that have some knowledge above other people, and those are the people you go to.
Yeah, I've been at it a long time.
Yeah.
And you see a lot of stuff, and you have a lot of experience, and I have a lot of clients with experience on how does this work. Here's what I've seen. Here's why I probably wouldn't do that. I would do this. It doesn't make me any better or any smarter necessarily than anybody else. I just have a lot of miles on me,
Well, you learn from your past experience, right?
Yeah.
And you try not to repeat the mistakes that you've made before. Every once in a while you get trapped again. But we're thankful to be able to have people to go to.
That's right.
Everybody wants to do everything online, and that's not the way to do these things.
And it's amazing. I love the information that's available. But you're right. Sometimes I see some people who are curious, and I'm a very curious person, so I read a lot. But there is something that I see sometimes, and it's almost like I don't know, analysis paralysis, or so much information that people just get stuck, and everything's really complicated. And the other thing that I found is most really good problem-solving devices are relatively simple. I'm sure you've heard the term Occam's razor, right? And I think really smart people, efficient, productive, smart people, have learned how to solve complex problems with simple solutions. And that's something that can be done. And it's not saying, that everything is simple, but it's saying that, like I have a good attorney, right? He's got a lot of books on his wall and he has a lot of information. When I go to ask my attorney to help me solve a problem, I don't want to know everything that he knows. I'm glad that he knows a lot of stuff. I want him to know what my problem is and be able to dig into that wealth of knowledge of 20 or 30 or 40 years of experience and very simply present a solution that makes sense, that we can, that's what a good doctor, a good surgeon, a good counselor, a good teacher. I think it's, I think that's what separate, the rock stars from everybody else.
I completely agree with you. And you get that in your agency, and that's what impressed me from the get-go. And I got to tell you, anybody that I've sent there or anybody I know who's gone there has come back happy.
Good. I like happy people.
Yeah.
I do. I mean, I've literally turned some people away and said, I don't think.
I was going to bring that up because I know somebody. You said you stay where you are because you're right where you need to be. I can't help you.
Yep.
Yeah.
Absolutely.
And that's when you do business with somebody. That's the person you want to do business with because they're looking out for them, not you.
That's the other thing. We're fortunate. A mature person in business. I didn't say that right. You know
what I wanted to say?
I do.
You're looking out for them, not for yourself.
Myself, correct.
Yeah.
Early on in the business, when you're starting any enterprise, like one of the terms that I often use with new brokers who I might be training is don't have commission breath. Well, what's commission breath? Commission breath is early on, these agents are compensated by how many clients they accumulate, so they want to sell. And, and sometimes that's, the beauty to where I'm at in life is I don't need to sell. I don't need more business. I want more business, don't misunderstand. I want to grow, but if you come into my office and you need to stay where you're at, I can afford to tell you, don't change a thing.
Don't change a thing.
Stay where you're at.
Yeah. Tom, we're at our first break, and we're going to come back and talk a little more about health insurance and then talk about the financial aspect.
Thank you.
And investments. We'll be back with Tom Yakopin from Penn LIfe Health on the Dr. Ed Show. Welcome back to the Dr. Ed Show. I'm Dr. Edmund Sulkowski, and we're here with Tom Yakopin from Penn LIfe Health, talking about a number of topics that are important to your everyday life and your health and wellness. We talked about Medicare, and that's important for a group of people, but healthcare is important. So I want to spend a little time talking about just health insurance. A lot of people, Tom, are provided health insurance through their employment, but there are people that don't fall in that category. And there are also people that might have lost their job and they need to have coverage during that period. Do you offer abilities for people to have the coverage for health insurance?
Yes, absolutely. So, as we were saying earlier, typically people 65 and above are involved in, a Medicare, either original Medicare, Medicare Advantage. But really, we built the agency. In 1988, I started target marketing self-employed people. I felt that one of the biggest underserved markets was the small mom and pop shop, the independent contractor, the roofer, the truck driver, the a landscaping guy or gal, and on and on. And really, if you really look around, like even on your ride home today, notice how many pickup trucks and
I do all the time.
vans, have, Joe's chimney sweep, and real estate agents are typically, not always, but typically 1099 independent contractors. So you have all of these really cool, innovative, self-employed people. But when it came to health insurance, what dawned on me is very often they were overlooked, marginalized, typically paid the most and got the least when it came to benefits, right? And so in '88, I started really hammering, buying lists, cold calling, going to 84 lumber stores and, putting boxes there, affordable health insurance, put your business card in. And I built a heck of a practice serving small businesses,
Well, I paid my own health insurance my whole adult life.
That's how we met, right?
Yeah.
Helping you with that. Yeah. So if you're under 65 and you pay for your own health insurance, we can help. Again, I would suggest people visit us online at westpennlife.com or pick up the phone and call 724-228-7187. Schedule an appointment, tell me what your problem is, and we can probably solve it. But there are all kind of cool tools for individuals seeking affordable health insurance to manage their risk between wherever they are now and when they age into Medicare. And of course, in Pennsylvania, you've got Penny, which is the state's exchange to sell ACA qualified insurance. And we are authorized to navigate the Penny program.
So what is ACA?
ACA is Affordable Care Act. So the ACA is basically Obamacare, Affordable Care Act, which came into being in 2014. The law was written in 2010. And it created an entire scope of health plans that are called qualified, meaning they meet the government's agenda for what is a comprehensive health plan. I think a lot of it's foolishness, and the very fact that most people need a subsidy to afford it. If you're a thinking person, if the federal government has to fund something, it's fair to ask, why is it so expensive, right? Because health insurance never used to be expensive. But there are so many mandates, so many things baked in the loaf, if you will, of the ACA plan. Just one example might be, maternity, full maternity coverage. Now, if you're, planning on having children, you're a young family, great idea, right? But what about a 62-year-old female who's had her uterus taken
But
out?
you're still paying for that.
Why does she need maternity?
Yeah.
Or a 59-and-a-half-year-old single male, why does he need maternity? Well, none of that was factored in, and that's one of the tragedies to big government solutions, right? They often create problems when they're trying to solve them, because again, a one-size-fits-all approach to practically anything usually is a bad idea.
I had that on my home insurance. I had outbuilding coverage and boat coverage. I didn't have outbuilding or a boat.
Yeah, so that's my point. So one of the things that I've often talked with self-employed people about is thinking outside of the box. There are free market health plans that are not ACA qualified, meaning they do not come under the banner of comprehensive major medical, but not everybody needs comprehensive major medical. Not everybody wants it. There's a series of commercials on television, which actually I've heard so much I don't like them, but I think it's Liberty Mutual, pay for what you need.
Yeah.
And there's some wisdom to that. Not everybody wants to manage risk the same way, So if you pay for your own health insurance, if you're self-employed, we can help you. And I will guarantee you that we have some ideas and some solutions that the average broker in Pennsylvania or the United States doesn't have. And that's one of the reasons why we've been so successful, not only here, but in 29 other states across the country.
I was going to say, you're just not local.
Oh yeah, I have agents in
country.
Utah, Florida, Texas, Chicago, Arkansas, all over the country that I've taught this. And actually contract to write one of our unique products under the banner of New Era Health Plans. And I got involved with New Era Insurance Group. I met Dr. Bill Chen at one of those Free Market Medical Association meetings, and Dr. Chen's the CEO of New Era, a very bright man, actuarial scientist, graduated from Purdue, graduated from the University of Taiwan, very smart man. But he's a numbers guy, and he has a background of Eastern medicine, looks at things a little differently, and came out with an entire suite of products that are very innovative, and they're very different. And he and I became friends, and we partnered. I own New Era Health Plans, which is a independent corporation. It's a field marketing organization that distributes their products, but we're one of their main partners because I liked his vision, and I liked the fact that it allowed me to bring something to Pennsylvania and to many agents and agencies around the country that many of them have never heard of before. And it's kind of a travesty. Going back to what we discussed the first segment, you don't know what you don't know. And a lot of insurance brokers, they get their license and they are enamored by the big names, Blue Cross, UPMC, Aetna, Cigna. I don't know what it is about us, but sometimes you can think that big is best. MetLife's an $18 billion company. They must be great. I remember a mentor of mine, John Savage, the late John Savage, said, "Tom, if big was everything, elephants would rule the world." It's not so. I'm not interested in how big a company is. I'm interested in how good they are.
Actually, when they get too big, they become less personal.
Thank you. Well, there's something to be said about that. If a company that is selling a health insurance product can amass millions and millions and millions and millions in dollars of profit, one might want to examine of every dollar they're taking in, how much goes back to the consumer that they are insuring,
right?
Or how necessary is that product, right?
I mean, it's like a casino in Las Vegas.
Bingo, So we do some things differently, but man, for the underage, I love self-employed people because you have to have guts to do it.
So how do we handle, I just lost my job.
Okay.
And I don't have health insurance now.
Sure. There are a lot of ways that we can solve that problem. If they have a lot of health conditions, pre-existing conditions, that's where something like Penny is super helpful. We can navigate that path. We can help them find a Penny plan. Potentially, they qualify for subsidies, so we'll ask them about household income. In fact, I had a very dear friend come in this week, an old guitar player buddy of mine from the early 80s, prolific guitar player, I might add. But his son just came off their health plan. I don't know what happened. He is attending Penn State. And we were able to help Mark and his wife Trinae come in and navigate that maze, find a very affordable solution for their son. If you lose your job, there's Cobra, there's Penny, and then there are free market options such as New Era Health Plans.
So sometimes younger people who aren't covered think I'm indispensable. Nothing's going to happen to me.
Sure.
I don't need this coverage, but they do because accidents do happen.
Accidents happen, and you never know. And I remember being youthful, right? You think like, hey, I'm Superman. I've overcome everything thus far, and I can overcome everything henceforth and forever. But it isn't true. Stuff happens, right? Broken bones, stitches, cuts, bruises. But then you can also have, appendicitis. And to be frank with you, a couple of days in the hospital could put a dent in your weekend if you're paying cash, right?
Right.
Now, I actually don't believe everybody needs health insurance. I think people should have the right to say, I don't want it. Okay, no problem. But, you should have some mechanism of handling that risk if it occurs, right? You don't want to default. You don't want to, be a bum and not pay your way through life. If people are going to render service, you have to have some mechanism. of paying that bill, and so young people should think about it.
Well, in the past, I've heard you talk about transparency in charges from hospitals or from labs and so forth.
Correct.
So you have the ability to find out what something's going to cost you before you go and do something.
Correct. In most cases, you do. So part of the Price Transparency Act, my understanding is it was written into the Affordable Care Act that people have a right to know the cash pay price for things. So, in many cases, for example, at St. Clair Hospital, you can go online and they have a tab in there where you can go in and search for various tests, surgical procedures, yada, yada, yada. And you can posture as a cash pay client, and they will show you what that particular procedure cost if you're writing a check. And by the way, it's amazing how inexpensive many of those procedures are when insurance is not involved. One of the biggest challenges I find is, I think it was Mark Twain was saying, it's easier to fool people than to convince people who have been fooled that they indeed have been fooled, okay? And one of the challenges to health insurance today is that it masks the actual price of things. If you think about it, the average consumer that has a health insurance plan, all they really know is they're paying a premium. They might have a copay for this, but they don't even care what stuff costs. They're not asking their physician, what are you going to charge me for this CT scan at this place over here that you recommend I go? But what's interesting is that certain procedures like a CT scan, if it's run through traditional insurance, they might bill, I've seen $3,000, $4,000 for that scan. If you pick up the phone and call that same facility and say, I'm a cash pay price client, I have no insurance, I need this, I'm gonna write you a check or give you my credit card, it might be $500. And the average consumer doesn't know that. The average consumer doesn't know that the price of an x-ray cash might be $12. Why do I need insurance for a $12 procedure? Why do I need to buy a product that might cost $1,000 a month for things that in fact could be that affordable? An office visit to go see a doctor. The average person doesn't know what the cash pay price for an office visit is because first of all, they've never asked, they've never been coached to ask.
Well, I've heard stories where people have gone and their insurance pays for their medication.
Yes.
And the medication, they have a $50 copay, and the medication actually only costs $20.
I've seen where the medication might cost $7 and their copay with the insurance is $20. They're actually getting hosed. It's almost criminal. And that's what some of my friends in the Free Market Medical Association, Dr. Marty McCary, we were talking about him off the air, Dr. Keith Smith, these guys have turned me on to ideas that I didn't know because I kind of grew up inside of the insurance business thinking that, it was, a good and pure industry. And it's not all bad, but there's a lot of fraud, waste, and abuse. There's a lot of lack of transparency. So, again, for people that want to navigate health care, which is, between you and your physician, your daily habits, if they want to navigate that without traditional health insurance, there are ways of doing it. And there are piecemeal products out there that can help people, or maybe they can just take the risk of paying cash. But there's a lot of good information available to help them stay out of the weeds, okay?
Yeah. I kind of think starting next year, things are going to start to change a little bit.
I agree with you. I think people are waking up.
Hopefully that will happen.
Yeah, hopefully it is. It's sad, man. It really is to see, the price gouging that goes on. That is, it's needless, and it's obscene, to be very honest with you.
There's something called life insurance, which I think is an oxymoron. I think it's death insurance.
Yeah.
But what is life insurance, and does the average person need it?
Yeah. So we talked about this on radio the other day, right? So again, Penn LIfe Health. My license gives me scope of authority to deal with life products, health products, and fixed interest annuities. But life insurance is an interesting product. It's an old school idea. And actually, it's not a bad one. and that is you die, okay? We all die. I don't like the idea of it.
That's why I'm thinking it should be death insurance.
Yeah, right. But the concept of life insurance is this, is that, Joe Blotz, for example, gets married, has a couple of kids, they buy a house, they have a mortgage, they have car payments. They, they become interdependent, right? Husband, wife, maybe dual income, whatever. And what we talk with people about is, again, God forbid, right? You never hope that somebody's going to die prematurely, but it does happen, okay? You can open the newspaper every day and there are people in the obituary, I'll guarantee you, that didn't expect to be there, okay? Life happens. So what happens if Joe is killed in his mid-30s, unfortunately? What happens to that mortgage payment? What happens to the spouse? What happens to the children who were technically, thinking dad's going to be around for the next 20 years to take care of us? That income is gone. What if he's making $100,000 or $200,000 or $300,000 a year? How do they replace that income if he's taken out of the equation? That's the miracle of life insurance, is that we can sit down with a young family and we can do some quick financial planning. What's your mortgage? What's your income? What's your education? Do you want to set up an education fund for the kids, your debt, things of that nature? I call it HIDE, house, income, debt, education. If I look at those four things, I can make a strong recommendation for how much life insurance they should have. And God forbid, if premature death happens to either of these people, we'll write a check. My insurance company will write a check to make sure that the economic situation is not disrupted, to make sure that that house is paid for. They don't have to leave. The kids can go to college. All of those dreams get funded, and that's what life insurance does.
So the underwriters who write these policies are betting that they're going to collect a premium over a number of years and
Correct.
you're not going to die.
Yeah.
And then you're holding the life insurance policy in case some unforeseen thing happens.
That's
and you
correct.
do die, you've covered your family.
That's right. Going back to my friend Dr. Bill Chen, an actuarial scientist, there are mortality tables, right? Morbidity is loss ratio with health. Mortality is loss ratio tables for death. But they pretty much know the law of large numbers is really informative. So if you look at a lot of death, okay, you look at males in the United States of America, they can pinpoint with great accuracy when men die in the United States of America. They can pinpoint, now these are averages, right? They can pinpoint when females die in America. So that's the benchmark number. And an insurance company says, all right, you're going to pay us a premium. Let's say you buy $1 million policy. You might pay, X number of dollars if it's term for 20 or 30 years. And yeah, the insurance company's betting you're going to live, okay? And they believe you're going to pay them this money and they're going to profit. But they're also on the hook that if you don't live, they have to ante up and write a significant check to your family. That's really what life insurance is. And there's term, which is just a death benefit, and it lasts for a period of time. And then there's permanent insurance, which costs a little more but builds equity and lasts forever. And they both have a place.
So long-term is an investment?
I would never say that life insurance is an investment, okay? An investment, that's probably not language that I would use when describing life insurance, but I can say that life insurance can build cash value. It can qualify for dividends if it's participating whole life. There are some sophisticated life insurance products that are tied to the stock market, like an indexed universal life. So there are life insurance products that can create a lot of cash inside, but I really don't look at them as investments. Where permanent cash value life insurance becomes handy is there are certain situations where a term policy is just not right for the model. For example, let's say a farmer friend of mine, and this is a real example. A farmer friend of mine, they had a working dairy farm. a lot of acreage, and they were never really wealthy people. But when gas and oil came into the industry, all of a sudden these people have a lot of money, okay? And they have 5 children. And when mom and dad passed, they would like that farm with the gas and oil rights to go to the 5 children. So what we were able to do in that situation is, using some sophisticated software, basically plan for what the estate and inheritance taxes would be, create a living trust, buy a life insurance policy owned by that trust, so that when the second person dies in that family, that life insurance policy comes in and pays all the estimated local, state, and federal taxes, so that that entire estate goes to their kids rather than the government.
Yeah, because
that's where a permanent life insurance plan is pretty important.
Because when you add up all those taxes, there's a much left, and some people can't even inherit the property that they've had because of the taxes they have to pay.
You'd be surprised at some of the estates. Like, I remember when I worked for MetLife way back in the day, we studied estates like Elvis Presley, some pretty well-known big money people. They, some of them were great entertainers, but they were foolish businessmen, and in many cases maybe lost half of their estate or more to various and sundry forms of taxes. So life insurance can be that sophisticated. It can be key man. For example, sometimes businesses will call us and go, we just hired a really hot executive who is driving millions in revenue to my company. But God forbid if that executive is killed or taken out before we expect them to be, it may take us years to replace them. It may cost us revenue. They might buy a key person life insurance where the corporation owns it, pays for it, and is the beneficiary. So if that key executive dies prematurely, the corporation has money from the life insurance contract.
Never heard that one before.
Key person.
That's interesting.
There are buy-sell agreements. For example, let's say that you and I are partners in a new business. And the business is worth $2 million, okay? And you're married and you die. Well, guess who my new partner is?
Yeah.
Your wife. I may not, and this is
exactly.
I don't want to be in partner.
I understand that.
So we may have a life insurance deal structured where we have a written buy-sell agreement funded by life insurance, so that if I die, God forbid, or you die, there is money created through the life insurance. We could buy each other out. Okay, so it could be as simple as funeral, burial, and final expenses, or it could be as sophisticated as saving an estate millions of dollars, or a business, or on and on it goes. So life insurance is pretty cool.
Are these benefits taxable?
Life insurance pays an income tax-free benefit. It's another way of creating an immediate estate. And by the way, it's, for those who are concerned about generational wealth, people that come from nothing, if they wanted to, could buy a significant life insurance policy and keep it so that they can create income tax-free generational wealth. And by the way, people used to do that.
And the earlier you buy it and the healthier you are, the less the premium.
Bingo. Yeah, and the older or the more bumps and bruises, the more it's going to cost. So it's best to think about this when you're young.
Do you offer services that are investment services?
Yeah, so back in the day, I did offer stocks, bonds, mutual funds, variable products. I let all of that go because it's really tough to be good at everything, right? I don't want to be 3,000 feet wide and a ½ inch deep. So I chose these 4 areas of expertise. The thing that we do with retirement planning is I stay in the safe money annuity space. And I partner with somebody in town, GBU Financial Life, for that.
That's risk-free.
Risk-free. Interest-based products, annuities, but they're fully guaranteed, okay? So that person that comes into the office, and very often we get a call, hey, Tom, I'm retiring. I need help with my Medicare, and maybe you can help me roll over my 401k. I want to know what to do with that. So, that's something that we do, and I recommend for people typically over, 55, over 60, whatever, that it is probably a prudent idea to keep your nest egg in a very safe environment.
No risk.
Yeah, you don't want risk at that time.
Tom, we're at the end of the show.
Wow.
So I want people to be aware how they find Tom Yakopin in West Penn Life and Health?
Sure. Well, of course, we're located 1100 Washington Road in Washington.
Out by the racetrack.
Just up from Steel City Harley and the racetrack. Free parking, nice facility, a couple of conference rooms, a warm place to sit down and talk. Or we're online 24/7 at www.westpennlife.com. And of course, they can call. The front desk is 724-228-7187. That phone would typically be handled by Shernice Wilson, my executive assistant, who's also a licensed agent. So we can chat by phone, we can chat by Zoom, we can do Zoom conferences where from the convenience of their home, we can quote, show them products, evaluate products online. They never even have to leave. So whatever works for people, online, phone, come into the office, or we can do Zoom meetings now. Pretty cool.
And you can also go back to my podcast on rumble.com, Xfinity, Spotify, iTunes, and Tom's been on my radio show many times, as well as this show many times. And you can tune in and kind of hear some of this over again. And of course, this will be archived and you can hear it again. More importantly, get a hold of this man if you need this type of help, because he's the right guy to go to. Mm-hmm. Remember, a healthy pet is a happy pet. When you're healthy, you're happy as well. And you can listen to me live every Saturday morning on AM 1250 The Answer at 9 o'clock from 9 to 10, and also on 92.5, as well as those social media places I mentioned. God bless. We'll talk to you next time.